This animation describes the interactions between tuberculosis, or TB, the human immunodeficiency virus, or HIV, and your immune system. This character represents active TB. This character represents HIV, and this character represents a white blood cell in your immune system. TB, HIV, and white blood cells are very small and can only be seen with different types of microscopes. In this animation, we show them much larger than they really are, so you can easily see them. Although TB bacteria and HIV are completely different infections, when someone is infected by both, they can work together to further affect their health. For example, people living with HIV are 20 to 30 times more likely to develop TB than people without HIV. This is because HIV weakens your immune system, making it easier for TB bacteria to survive in your body. This animation explains the danger of becoming infected with TB if you are living with HIV and how this can change the diagnosis and treatment for TB. Having TB and HIV together weakens your immune system even further and makes a person become ill more quickly. For example, HIV accelerates the progression from latent TB to active TB. Latent TB is when you have the TB bacteria, but you do not have its symptoms, such as a chronic bad cough, pain in the chest, or coughing up blood. Latent TB can remain in the body for years, decades even, without becoming active. Active TB is when you have both the bacteria and the symptoms, and can infect other people. If you live in a country where many people have TB, you may be infected with TB before you realize it, especially if you are living with HIV. TB bacteria are spread through the air when a person infected with active TB coughs, speaks, or sings, so it is not hard to transfer from person to person. Having TB and HIV together complicates the detection, diagnosis, and treatment of these infections. It becomes critical to work very closely with your doctor or healthcare provider to treat TB and HIV. Appropriately treating HIV will help rebuild your immune system. This immune system is your main defense against TB. Sometimes this will cause TB symptoms to be more apparent or severe because your immune system is fighting the infection. When starting HIV medicine, you should make sure to report every new symptom to your doctor and make sure not to stop your treatment. When someone has HIV, testing to see if they have TB becomes much more difficult. TB is often diagnosed by observing symptoms, using X-rays of the lungs, and through diagnostic tests. People living with HIV who are also infected with TB, however, will sometimes show few, if any, TB symptoms and will have normal chest X-rays. They can also have what is called a false negative result. A false negative is when someone has TB, but a diagnostic test cannot detect it. To avoid a false negative result, it is recommended that healthcare workers use the Gene Expert test when looking for TB in people living with HIV. Although the Gene Expert test is more expensive, it is more accurate in this case. Ask your healthcare provider if this test is available. Having TB and HIV together also can complicate treatment. For instance, some of the drugs, like rifamycins, used to treat TB interact with the drugs used to treat HIV, making them less effective. Your doctor will know which drugs to use in people living with TB and HIV. As you can tell from this animation, the interaction between TB and HIV is not simple. If you have HIV, this means you must work very closely with your doctor or healthcare provider to determine if and when you should be tested for TB while monitoring your health. Similarly, if you have both HIV and TB, you will want to work closely with your doctor or healthcare provider to identify the best set of drugs to effectively treat both. Always be sure to take your treatment exactly as your healthcare provider has advised. This is very important for your short-term and long-term health. Healthcare providers are there to help you in situations such as these. They want to help you follow your treatment and watch you succeed and get better.